Gentlemen, if you've been waking up softer, slower, or simply not feeling like the man you once were, there is one overlooked pressure point silently restricting your potency, and today I'm going to show you how to release it. Before we begin, make sure you subscribe to this channel because each week I teach men how to restore circulation, confidence, and intimate vitality without confusion, without pressure, and without embarrassment. Are you waking up tired, less responsive, less firm, or noticing those quiet moments with your partner have started to feel more stressful than enjoyable? Has intimacy shifted from something effortless to something uncertain? I'm Dr. Lena, board-certified urologist with 18 years of experience helping men rebuild healthy blood flow, nitric oxide function, and reliable erection strength. And today, I'm revealing a 60-second release point most men never learn about, yet it plays a powerful role in restoring natural potency. Before we begin, tell me in the comments where you're watching from. I love seeing how far this information travels to support men just like you. The real reason firmness declines. Most men think potency fades simply because testosterone drops, but here's the truth I see every single week in my clinic. Many men experiencing weaker erections have normal testosterone levels. Their labs show numbers perfectly acceptable for their age, yet they still struggle with weaker morning erections, slower arousal, less rigidity, decreased sensitivity, performance hesitation. So, if testosterone isn't the full story, what is? The quiet decline no one talks about. Over decades, a slow tightening occurs deep within the pelvic floor. Why? Long hours sitting, daily driving, desk work, recliners, couches, firm seats, stress clenching without realizing it. The pelvic floor, which should stay elastic and responsive, becomes rigid, just like a hand that stays half-clenched for years. That constant tension compresses micro blood vessels supplying the penis and the pudendal nerve that triggers erection response and sensation. This is not sudden. It happens silently, softly, consistently. Add age-related nitric oxide decline, and those vessels become stiffer and less willing to expand. Picture your pelvic circulation like a highway. At 25, open, clear, responsive. At 55, small traffic jams begin. At 65, flow still exists, but it slows, weakens, hesitates. Men turn to pills hoping for a shortcut, but pills widen vessels temporarily without releasing the muscular chokehold causing the blockage in the first place. That's why so many men tell me, "Doctor, the pill helped a little, but didn't fix the problem." It can't. You're increasing pressure while the passage is still compressed. The 60-second pressure point. Now, here's what almost no one explains. The gateway to healthier pelvic blood flow isn't in your lower abdomen, hips, or back. It's in a small region nearly every man ignores, the perineum, the soft tissue between the scrotum and the anus. That small, stretchable area is the crossroads of major penile arteries, the pudendal nerve, erectile pathways, and pelvic vascular regulation. When that area tightens even slightly, firmness weakens, response time slows, stimulation becomes less intense. Not because you're aging in the way you fear, but because one pivotal bridge point has narrowed. Think of it like placing your thumb over a garden hose. Water still flows, but not powerfully. How to release it? Step by step. I'm going to guide you exactly as I do my patients. Calm, slow, clear. Position. Sit at the edge of a chair. Feet flat, back relaxed, pelvis slightly forward. If sitting is uncomfortable, stand with knees gently softened. This is not stretching. This is opening. Finding the point. Use either fingertip for gentleness and accuracy, knuckle for deeper tissue. Locate the soft tissue between the scrotum and anus. Feel around slowly. You're searching for tender, not painful, a deep knot-like sensation. Pressure. Apply gentle but firm pressure. Not digging, not pressing hard, just steady release. Enough to feel tension melt rather than fight. Breathing. This is the key most men miss. Deep inhale through the nose. Exhale slow, letting the pelvic floor drop. If you breathe shallowly, the muscles grip harder. If you breathe deeply, the tissue unlocks. What you may feel: gentle ache, warmth, tingling toward the penis, soft pulsing, all normal. All signs of circulation waking up. Sharp pain is not normal. Lighten pressure if that occurs. Time. Hold for 60 seconds, not less. Why 60? Because anything shorter only touches surface tissue. A full minute signals the nervous system to let go, soften, and allow flow. Many men tell me they feel warmth, heaviness, releasing, increased awareness of the area, or light pulsing afterward. That is the pathway reopening. Why most men stop too early. Releasing the point is half the picture. Now the body must maintain flow, elasticity, and oxygenation. Daily circulation ritual. No sweat, no strain, just movement. Slow glute bridge. Lift hips gently, core loose, pelvis open. Supported squat hold. 10-20 seconds, using a countertop if needed, encourages blood movement. Deep diaphragmatic breathing. Strengthens nitric oxide release, relaxes pelvic floor tension. These are not workouts. They are vascular reminders. The nighttime factor. Here's the part older men rarely hear. Nighttime erections are not sexual. They are maintenance. They oxygenate tissue, prevent vascular collapse, preserve elasticity. If you rarely wake with morning erections, that tells us nighttime blood flow is restricted, tissue isn't being nourished overnight. Even improving sleep by 25 minutes increases testosterone rhythm, nitric oxide cycling, nocturnal circulation. Nitric oxide food boosters. You don't need complicated supplements, just small additions. Spinach, beet powder or juice, dark chocolate, 70% plus, citrus fruits. These help the vessels relax and widen, exactly what aging pelvic circulation needs. A message every man over 50 needs to hear. If you're feeling discouraged, embarrassed, or convinced that your best years are behind you, I want to speak to you directly. You are not failing. You are not broken. You are not too late. The male body is resilient. Circulation can improve. Nerves can calm. Elasticity can return. Confidence can rebuild. Naturally, steadily, consistently. I have witnessed men in their late 70s regain function they believed was gone forever, not because of miracle treatments, but because they finally addressed the root cause: restricted pelvic flow, silent tension, and ignored vascular compression. Your body is not your enemy. It simply has been asking, quietly, for release, support, and blood movement. If today's guidance gave you clarity, hope, or even a renewed sense of possibility, make sure you subscribe and stay connected. You deserve confidence. You deserve circulation that supports you. You deserve restful sleep, strong flow, and reliable potency that returns because you know how to care for it, not because you're forcing it.